My name is HeiShun and I'm a fourth-year radiology resident at Boston University Medical Center. One challenge that we face in the clinical care of cancer patients is the language barrier. For our clinical colleagues, the language barrier causes problems when trying to give instructions to patients, whether for treatment plan or for follow-up appointments. When it comes to counseling these patients, the language barrier often makes it difficult for patients to understand their disease, their prognosis, and even the importance of adhering to the treatment plan. Now, for the diagnostic radiologist, the language barrier comes into play when we're trying to make sure that the patients show up for their appointments, and when we try to make sure that the patients adhere to the pre-appointment instructions. An example of this is when patients come for their staging PET CTs. These patients are instructed to fast for a period of time prior to their examination. What gets lost in translation is that when they don't fast, they render the examination non-diagnostic, which means that these examinations have to be repeated. Another point that gets lost in translation is the importance of punctuality. These examinations are ordered for specific times because radiopharmaceuticals expire. Now, if the patient comes in late and the patient dose is already expired, then the patient dose will have to be reordered and the patient will have to be rescheduled. Now, the problem that this challenge causes is twofold. First, this challenge directly contributes to rising healthcare costs. As I already alluded to in the nuclear medicine department, the patient dose would have to be reordered, which is a direct cost to the hospital, and in some cases to the patient. Now, the second problem arises that when the patients don't understand the severity of their disease, they tend to get lost to follow-up. And even patients that are identified with early stage disease, when they finally present, they present with end stage cancer. Now, this obviously has a significant impact on the patient's prognosis as well as quality of life. Additionally, this also leads to increases in healthcare costs because the treatments for these end stage patients are just usually more costly and less effective. And many of these treatments are just palliative and not really curative. A solution to this problem may be information technology based. Currently, translation apps are already available. Now, adopting these apps into the medical community may help to break down the language barrier. Alternatively, development of real-time translation services via video chat may also be considered. Such solutions can reduce the disparity in healthcare faced by these non-English speaking patients.